And I learned something. Okay. Love your heart. I learned that too. That's a good thing to remember this Valentine's Day. And that's why Dr. Chirstine Zirafi is here from the Parma Community Hospital to tell us something about this. And sometimes when we hear about all these different heart problems people are having, cholesterol, some reason they don't seem to focus on the ladies so much. Why is that, you think?
I think because originally heart disease was thought to be a more male-dominated disease, but it's actually the #1 cause of death in women.
Number one.
Number one, more than all the cancers put together. So the American Heart Association has started the Go Red campaign in Women's Heart Month in February in order to get the, the word out to women and everyone.
And a lot of people think that you're not going to have a heart problem until you're in your advanced years. And that's not necessarily true, is it?
Not true at all. In fact, women over the age of 30 are often having heart problems, and our risk factors start when we're young, so we need to really know the numbers, know if we have high blood pressure or cholesterol level, diabetes. Women who smoke and use birth control pills have heart problems at a much younger age.
And do heart problems also relate to stroke problems?
Yes, they do. When we talk about heart problems, really talk about overall cardiovascular health. So heart disease and strokes are part of that.
And there's certain ethnicities that have more problems with this also, true?
Yeah, we have to worry about, typically in our Hispanic population, heart disease starts about a decade younger. Also in the African American population, high blood pressure is a far more virulent type of form of high blood pressure, and we have to get the word out for them to get treated also.
Oh boy. So is there a thing that people can start doing lifestyle-wise that would help them step in the right direction?
Yeah, I think it's recommended that we all get about 30 minutes of exercise 5 days a week, and that can be broken up into 10-minute intervals, so we all can have time for that.
So you don't have to get up in the morning and do an hour and sweat your brains out and think that it's done. You could do 15 minutes twice a day or take a walk and that sort of thing.
Yeah, oftentimes, during work, you can break it up on breaks or during your lunch hour. Obviously looking at what you eat and how to eat healthier is a good thing. And then knowing our numbers, our blood pressure, our cholesterol, our sugar, things like that are important for all of us to know.
Once in a while you talk to somebody and they say, boy, I had a rough night yesterday, or I thought maybe I should have called the hospital, or maybe I should have done something. I thought my heart was beating fast. Is there something that people should, the button they push to go like, I should call 911 now, or I should go to the hospital right now? Because people put that off too long sometimes, don't they?
Yeah, often. And actually women are worse at this than men, because women worry about their husbands or their kids more than themselves. And heart attack symptoms in women tend to be a little bit more atypical. It's not the crushing chest pressure. It's more like a severe fatigue or shortness of breath, and upper back pressure, jaw pressure. So anytime you're really not feeling well, it's always better to be safe than sorry and go to the hospital.
So we talked about exercise. How about drugs? Like people talk about an aspirin regimen. How does that work out?
Aspirin, everyone shouldn't just go out and buy an aspirin. You really need to talk to your doctor, because there are some complications from taking long-term aspirin use. So you really need to know if you're at risk for a stroke or a heart attack, and then make that decision based on your individual risk.
Great. Well, we learned a lot. Thank you very much.
Thank you.
Happy Heart Month, happy Valentine's Day, and all that kind of stuff to you,
Thanks,
Doctor. Thank you very much. I appreciate it very much. Okay, folks.